The number of people who have diabetes in the U.S. right now is about 24 million and growing. It's estimated that about 25% of the population that has diabetes doesn't even know it. So if you include the people who still don't realize they have diabetes, it's really more like 32 million Americans have this problem. That's more than 10% of our population. It's substantial because it's an expensive disease. When you're talking about diabetes, there's two kinds. There's type 1 diabetes, which I think most people understand is the one where the pancreas no longer makes insulin. And that means then that the body's ability to deal with glucose, with blood sugar, is completely gone. And they clearly need medication, and they need to stay on their medication. Exercise and diet can help avoid serious complications, but for a type 1 diabetic, to avoid insulin is really not an option at this time. Now, type 2 diabetes is a different phenomenon. It means that the pancreas, a wonderful organ there in the gut, does indeed still make insulin, but the insulin that they have isn't working quite so well. And there's degrees of not working so well. There's insulin resistance, where the insulin's kind of ineffective, to where it's pretty much useless. And a type 2 diabetic, unfortunately, sometimes winds up on insulin in order to control their diabetes. The good news is for type 2 diabetes that it can absolutely, completely, incredibly be solved with natural medicine approaches over a period of time. The keystones of that will absolutely have to be their complete cooperation around sane nutrition specific for that person. They're going to need to take some smart supplements and herbs. They will need to exercise and exercise in specific ways that include both an aerobic component as well as weightlifting. That will be their tickets to success if they want to be able to avoid having to take insulin and perhaps completely get rid of type 2 diabetes. In naturopathic medicine, when we're treating someone who has diabetes, whether it's type 1 or type 2, there's two paths we can go down. One is where we're working with a medical doctor, an allopathic practitioner, an osteopath, whomever it might be, which is a fine way to go. There are people who absolutely need both approaches. They're not ready to be independent from what conventional Western medicine has to offer. And in some people's cases, for their health, it wouldn't be a safe idea. It just wouldn't. Other people, particularly if they have type 2 diabetes, are ready to make that step. And if they are, though, they've got to cooperate. So this means then they can't decide to go rogue and have like a box of donuts. That's just not going to work. And believe it or not, there are people who do some silly things and they know better, but they still do it. So in our case, for naturopathic medicine, what we're trying our very best to do is target the things that are awry and get them back into good order so that health can be restored. Believe it or not, for a lot of diabetics, the real issue is they are depleted of the nutrients they need in order for their blood sugar to be normal. That, coupled with lifestyle habits like the kind of foods they eat, the quality of food specifically that they eat, especially the fats and the carbos and the proteins and those details, along with the kinds of exercise, will almost all the time be a huge support. So let's say it's a type 1 diabetic and they're trying to perhaps use less insulin or have an easier experience when they take their insulin so they don't have big gaps in the day. For their energy management, they would be well served. And somebody who's a type 2 diabetic, again, it's all about personal responsibility here, who perhaps really wants to have a longer leash between insulin medication or wants to get off of those kinds of management programs or be free of it completely, would be well served. But here's a caution for everyone to know. This is a time when you want to see a licensed health professional. You want the real thing, a naturopathic physician. You don't want to just converse with someone at the health food store or some other purveyor of vitamins and supplements because you don't know what the heck they're going to tell you. And believe it or not, there's still people out there who will tell members of the public that a type 1 diabetic doesn't need insulin. And it's a crime because that's not true. That's absolutely not true. Now for type 2, we can talk about that, but for type 1, really, we're still not there yet. Maybe the next generation of medicine will free everybody from that need, but we just have to respect what's real. So if you really want the results, you need to go to the people who can get it for you.